and we finally have a system in America to provide health care. That's helped 18 million people get access to health care. And in those states where it's working because the governors, unlike here, have extended Medicaid, hundreds of thousands of people are no longer going to the emergency room as their primary physician. You know, those of us who've had health insurance, I want you just to think for a minute what it's like to have a child or yourself with something not right, but you can't afford to go see about it until it gets so bad you end up in the emergency room. And that's what happens if people don't have some way through insurance to pay for what they need. I want to defend the Affordable Care Act, but I want to try to persuade governors like your governor here to extend Medicaid, to give working people a chance to have better health. Now, we have to improve the Affordable Care Act. It's not enough just to let it sit there. We got to get out-of-pocket expenses down. We have to tackle the rising cost of prescription drugs. It's gotten so bad that last year in Medicare, in just 1 year, the cost of prescription drugs went up 12%. So I have some proposals. For example, our drug companies do so much good for so many, and I salute them and thank them for that. But they are now spending more money on advertising than on research. And you've all seen those TV commercials. You can't avoid them. And they all have a certain look about them. You know, people running through fields of wildflowers, linked somehow to whatever the drug is that's being sold. And then underneath it, in a very low voice, it's like, you take this, your nose will fall off. But I mean, just watch, don't listen. So I don't think they should get a tax break for advertising. I want them to get tax breaks for inventing new cures, for saving people's lives. And the other part of this, which makes no sense, you know, all of us who are taxpayers, we pay to support the National Institute of Health, which does great work in partnership with universities and with drug companies in developing new treatments. And then we support the Food and Drug Administration, which does the testing to determine whether something can go to market. And then, after we've made that investment, we end up paying the highest prices for drugs in the world. Because every other advanced economy negotiates for a better deal. You know, when I represented New York, we have that long border with Canada. Every week, people would cross the border to go to a Canadian pharmacy to buy exactly the same drug at a much lower price. So I'm going to fight to make sure that Medicare has the authority to negotiate lower prices for the drugs that our seniors need to use.